Hi and hello, I am ATHEENAPANDIAN here. In this video I am going to say something about the furthermore topic of X-ray. In the previous videos we are just to see about the parts of the X-rays and everything. In this video I am going to say something about what actually the radiations are. What are all the dosage we need to prepare for giving the radiations to the patients. Okay. So X-ray is concerned, of course, it is coming under the radiology. It is a radiation exposure. Okay. So whether it is harmful or not, yes, of course it is harmful, but according to the protocol we follow, this amount of X-ray, this amount of radiation we are supposed to send to the patient, then it is not harmful. What is that range? That is called as a dosage they say. How much amount of dosage given to this patient? How much amount of dosage given to that patient? These are all decided by three important parameters. Okay, one is according to the age of the patient. Okay, then second is according to the gender of the patient, whether it is coming, he is coming under the male or she is coming under the female, and then according to the area of region, area of target, whether the patient required for the X-ray or the doctor required for the X-ray of the patient of wrist or the stomach or the chest. So according to the penetration, the area of target may be. Okay, these are all the three important parameters. According to these parameters, the dosage limit will be chosen. So if there is any range for the dosage setting or in the control panel, every X-ray machine have the control panel. Okay, in the control panel, the two important parameters are there. One is kVp and MA. What is kVp? It's nothing but a kilovolt peak. MA is nothing but milliamps. I already told you the potential difference between anode and cathode is responsible for the speed of the electrons, and I already told you in the concept was, once you are giving a 50 kilovolt between anode and cathode, 30,000 electrons are coming away from the cathode to targeting the anode. Okay. According to this particular scenario, we can set the kilovolt peak and milliamps. Milliamps is nothing but how much amount of electrons you require to target anode, and the kilovolt peak is nothing but how much amount of speed required by the electrons, that is intensity required by the electrons to targeting the anode. So according to that, we can choose the dosage. For example, it is a small baby, required the penetration, they require the imaging of the spinal cord. For example, the 5-year baby, 5-year-old boy or girl, he required the small amount of intensity because the penetration required is very minimum compared to the old age people. Okay, so during the time the kilovolt peak should be reduced. So we need to maintain the voltage difference much lesser than that of the 50 kilovolt. This is what the variation occurs. So all these parts is considered as called as a dosage interval. Okay, please remember the control panel is nothing but the kVp and MA setups. What is the reason they are set up? For maintaining the dosage. Okay, if you know about the dosage limits, then you can able to use the radiation in a proper way. Okay, thank you very much.